You are now tuned in to the Dads Who Lift podcast. Please give us a like, share, subscribe to the YouTube account. We are on www.dadswholiftofficial.com. All the podcast links are in there. We also have an apparel line. We're on IG as Dads Who Lift Official handle. We're on Facebook, Dads Who Lift Podcast. We also have a Dads Who Lift fitness group on Facebook that's Dads Who Lift Official. A group of 30,000 like-minded dads that are just trying to be their best selves and staying fit. If that's something you're into, please check it out. But we do this stuff for free, guys, so please give us a like, share, 5-star review. We really appreciate your support. You are now tuned in to the Dads Who Lift podcast. You have your host, Tyler Gata.
Co-host, Joel Staley.
And we have on special guest, Dr. Jim Wagner.
Hey, how you guys doing today? Appreciate you guys having me on the show. I hope to kind of share a bit about what I've been doing and how it might help your listeners and stuff like that as we go along. It's a pretty hot topic that's out there now. So,
yeah, absolutely. We're happy to have you, and thanks for coming on as well. You were just saying a little, pre-shoot before we started rolling here that you specialize in. I guess tell us a little bit about what you do and the injuries that you specialize in and that type of stuff.
Yeah. So I've been trained as an occupational therapist. So it's another one of those allied health professions that takes a look at someone's ability to perform like daily living skills after an injury or an insult to kind of rehab you and get you better. I've gone into a specialization within the field as a certified hand therapist that takes a look at a very intricate look at like shoulder, elbow, wrist, and hand injuries. So for the last 26 years, I've been working in that particular avenue. So everything from, whether it be a rotator cuff injury, a labral tear to, irritating tennis elbow to, carpal tunnel, those types of things, sports related injuries. And so I'm a team leader for our 5-hospital system. So we work with a couple hand surgeons in our area and stuff like that. So, and then, like I said, I've been into strength and conditioning I'm 49 now, so about 35 years or so. So doing that. So I kind of, I try to incorporate that into my practice and stuff like that as well as much as I can. So I like to treat some of the athletes, overhead athletes, weightlifters, powerlifters, bodybuilders, those types of things as well. So.
What is the biggest injury that you see as far as like bodybuilders? Obviously, we're the Dads Who Lift group. So a lot of guys in our group are obviously bodybuilders or powerlifters. What's the biggest injury that you see in, adults or men?
So probably the biggest injury that I see more than anything else is either elbow pain, lateral elbow pain, or else shoulder issues. So, and then again, I've dealt with both of them. After you've been around a while and stuff like that, you usually end up treating yourself most of the time. So, and that's how I got into a lot of my intervention stuff. Like I treat myself, and I saw whatever I prescribe to people for exercise and those types of things I do most of the time myself. So, I'm dealing with a left, rotator cuff irritation right now myself, a little bicipital tendonitis. It's irritated in there. So I'm trying to rehab that as well while I'm still training as heavy as I possibly can, So a lot of those things, really, when it comes down to it, if you've been training for a while, you better have some kind of good shoulder stability program that you're going to be working on over time. So we ain't getting any younger. So we've got to, those joints and stuff like that can only take that force for so long. So right now in the later on years of my lifting and stuff like that, I spend a lot more time on my mobility issues and really trying to get things better motor control and better support than all that power, which I want the power, believe me. But I also want to stay in the game as long as I can. So.
Yeah, I feel like mobility is one of those things that most lifters, until you need it, it's hard to get pumped about doing. Like I know,
right.
Same with stretching for me. They kind of go hand in hand in some aspects, but until you need it, until like your lower back starts hurting, your hamstrings are super tight, I never stretch unless I need to. So how do you, I guess, get people to stick to some sort of mobility exercises preemptively if you do?
You made a good point. And it's always like the do as I say and not as I do thing for years. I've been preaching this stuff, and do I do it? No. It's kind of like saying, I'm going to do my calf workout later on. Like, I'm not going to do my calf workout later on. I'm going to get those big muscles out of the way. Like the calves of a 5-year-old boy, but, can squat 9 million pounds. But, the biggest thing is with age comes a little bit of wisdom, I hope. And so now that I've known a bunch of my own injuries, and usually that's what happens, and we're all those guys who want a big bench press, big shoulder press, a squat, or a deadlift. So it's all those big, loading those big weights and stuff like that. Anything used to its greatest extent, sooner or later, it's going to break, right? So it doesn't matter how big and strong you are. So my goal now because I got a 20-year-old daughter and a 15-year-old daughter. I just want to stay just enough to be a little imposing, I guess. Somebody comes into the house and say, "Hi, Mr. Wagner," right? I want to stay big enough, strong enough to make them think twice before anything else. So I guess I'm trying to now, as staying in the game longer, I want to make sure that those joints and those soft tissue structures around those are going to be strong enough. So I think it's usually, like you said a second ago, when you have those injuries, you start to prescribe those and get into those more often. But I've got to tell you, and this is kind of where BFR, blood flow restriction, kind of comes into part of that. As we age, I don't recover as much as I used to. So instead of doing, loading those joints with a heavy bench, squat, or deadlift, now I'm throwing in a little more of that stability stuff and mobility stuff that's really helping to kind of bring out those lifts better than I ever had beforehand. I don't know about you guys, but I learned to lift from a Muscle and Fitness magazine with some little sand weights in my bathroom when I was like 14 years old. So I learned a lot of crappy, movements and not good stuff, but Joe Weider stuff. But anyways, it's really kind of helped me kind of evolve over the years and, stay in the game. So
what can a guy do to stay ahead of injuries? Say someone that's in their 30s, 40s and lifts heavy every day. I certainly know that my joints don't feel like they used to when I was in my 20s anymore.
Right.
I'll do a heavy ass leg day or something like that. My knees will be hurting for 3 days afterwards. What's something that guys can do to stay ahead of it to prevent those injuries?
I think that's a great question. And I incorporate a little bit more warm up than I ever had beforehand. Even simple things, whether it be, a lot of times people are anterior dominant. They got big quads, weak posterior chain. Maybe their glutes and hamstrings are a little bit weaker than they probably should be. Now, there's muscle imbalances. We always got we got the big pec muscles and deltoids and stuff, and the lats, but all those shoulder stabilizers, and everything's connected. So I think taking a little bit more look at those accessory single leg exercises, with like a lot of landmine work and a lot of asymmetrical exercises that help create stability in lifts, and focusing on some of your weaknesses. Really getting someone to take a look at overall. I didn't know I had a shitty squat until actually someone took a video of me squatting. It looked awful. Right. So then I was able to pick out my mobility issues and stuff like that. But spending a little more time, I think, on some of those weak areas. And I'm not a big supplement guy. The only thing I really take is a good creatine and my protein supplements. But I will take a branched chain amino, and that's actually been helped out with my delayed muscle onset soreness and stuff like that as well. I've actually noticed a difference in my recovery and stuff like that. And I think a lot of times we overtrain a lot. I'm 3 to 4 days a week. So I do like a Monday, Wednesday, Friday, and Saturday mobility day. And I try to do a little light, heavy, medium day. And to tell you the truth, I've gone up in numbers more so than I have in a long time. So actually getting some recovery and sleep. A lot of us get like 4 hours of sleep a night. You can't really expect, drink beer all day long and, get 4 hours of sleep and expect to perform hard in the gym. So we like to, but.
Right. I'm curious as far as shoulder injuries go. So if you have like a nagging shoulder issue and you get on YouTube or the internet, it has all these crazy exercises.
My shoulders are always tight.
I came across, I think some guy was on the Joe Rogan podcast a few years ago just talking about this book by a guy named Dr. John Kirsch. And it's basically by for any shoulder injury, they found that if you just hang from a pull-up bar for like a few times a day, as long as you can, shoot for like a minute, that is single-handedly for any shoulder injury. It shows the best recovery and improvement on it. Have you heard anything like that?
So there's a lot of stuff on the internet. You take a look at Graham and stuff like that. Here I'm 49 years old. I like to get out and see what kind of crazy things are out there and kind of filter through that stuff. There's some really good stuff. And there's some not so good stuff, and it can get overwhelming. Believe me, even myself, I'm like, oh my gosh, I've got this stability drill over here. I've got this, overhead mobility here. A lot of it really is a lot more simple. And I think, especially now on Instagram and places like, social medias, we've got to always have the latest and greatest new crazy exercise that's out there. Probably what they're looking at with that hang there, that dead hang, is probably like just capsule stretch and lat mobility. You figure you're hanging like that. Probably one of the biggest things I've seen in shoulders is people think that these things take a while. They take a while to rehab and stuff like that. And pain isn't always a bad thing. Pain may be an indicator that something's kind of not quite right, but you need to work on some weaker areas. What I found a lot of times in like the overhead athlete and like the weightlifter, bodybuilder, powerlifter guys that were really anterior dominant, big pecs, shoulders, And a lot of those little shoulder stabilizers, the rotator cuff muscle, the infraspinatus, teres minor, subscap, a supraspinatus, those types of things, the ones that really help to get that shoulder coordinated and moving really well, are weak. So, and then we got these big lats, that are hanging down here and all that stuff at night speed, but all those stabilizers shoulders. And I guess that would probably be anything that helps us to stabilize that shoulder girdle itself is going to be helpful. And then there's a muscle called the serratus anterior, which is really an underutilized. It's kind of like the end portion of the bench press. You guys are popping off, and you're getting that last few inches, that forward push, the scapular protraction, retraction. That exercise right there, or like a lot of serratus work, is a great exercise for shoulder stability. It's the boxer's muscle. It's that last, reaching out, punching through things. It's that fan you'll see on the bodybuilders that runs across the rib cage is underneath there. So it kind of helps to balance the shoulder blade and keep it in position. So, in stopping working out is probably one of the worst things you can do. The biggest thing is you can just find what the limitations are, what your mobility issues are. If you're hypermobile, you need to stabilize it maybe. If you're hypomobile, where you're stiff and tight, you need to mobilize it, and find what you're weak at. So to find one latest and greatest exercise, there's some great research articles. Now you guys can go online and look at, some great shoulder stability stuff. Some great stuff by Kevin Wilk, Mike Reinold, Boston Champion Sports with PT and stuff like that. So I'd say the biggest thing, if you got a shoulder issue, don't go right to the internet. You might find you're doing like 6 hours of a warm up, and then you get in, for your hour workout, and then, your day's gone. So maybe just have someone take a look at it, see maybe give you where your weaknesses are and what you need to work on.
So the blood flow restriction, I've been hearing about it for a long time, the occlusion training. I've never personally done it just because, I don't know why I haven't. I feel like it does work. It pumps a lot of blood into the muscle, gets you a pump. You don't have to lift as heavy. I think I'm almost a little bit nervous about overdoing it, because even when I tell myself I'm going to go have an easy day in the gym, I'm sure Tyler's the same way. You start that way, and then you just have you get the eye of the tiger, and you start getting after it. So I'm a little bit nervous I'm going to overdo it and pop something, or I just don't know what I'm doing. How'd you get into it? And can you tell us like the benefits and maybe some common mistakes that go along with the occlusion training?
Absolutely. Yeah. So I got trained years back by Dr. Jim Stray Gunderson. He was one of in 2013, he was one of the only Katsu masters in the United States. So Katsu, is Japanese for like add additional pressure. This guy back in the 60s is a Japanese powerlifter, Nakasato. He found he was in this Seiza position for a long period of time. It's like a funeral, whatever type of position. He was in a kneeling position. When he stood up, he felt like his lower limbs, his legs had this fatigue factor like he'd had for a long period of time. He had a leg workout. Oh, I don't know what makes people think about doing stuff like this. Then I think it was in the 70s, wherever he had a broken femur or something, fracture or something like that, and was immobilized for a period of time, and began to start to work with pressures around the particular limb to see if that would create any, activation of muscles or muscle hypertrophy, that type of thing. He noted that when his cast came off, that his quadriceps, his leg wasn't atrophied or as wasted as it was of just being, completely immobilized. Well, it's been around for a while, this BFR, this blood flow restriction. A lot of people call it occlusion training. I don't like to call it occlusion training just because when you think occluding, you think you're strangling something. So I don't want to occlude any arterial blood flow in. So really what you're doing with a blood flow restriction is that you're occluding the superficial venous structures or the deoxygenated blood that's distal to the band or the cuff. And that gets pushed back in with a muscle pump to get reoxygenated blood from the artery coming back in distal. So it really took off with the European bodybuilders for a while and stuff like that. And they were using all kinds of like straps and all kinds of stuff. Problem was there's a lot of injuries with it too. I mean, you're having someone wrap a powerlifting strap or something around their arm to get like a nerve injury or something like that or whatever. There wasn't any really good way to kind of objectify it and keep them more safe. But they did notice some improvements. You guys remember the Ultimate Warrior?
Oh yeah,
dude, that guy was jacked, man. He just strapped those whatever things on his arms, and it was basically like BFR. He's pumping himself up, the vascularity and stuff like that. It was crazy, but it was uncontrolled. So I'm not saying he did that on purpose. So the point is that it's kind of like that thing right there. So the concept behind it is that again, they found over time, and this mostly was started with like age-related sarcopenia, or basically like people who've been in bed rest for a while, and those types of things, is that they're actually doing this with people to kind of mitigate, muscle weakness and muscle atrophy, help with strength. And so there's actually a lot of research. I've got tons of it on there about the benefits of it. So basically you take a band or a cuff, and there is a difference between the different cuffs. Use a couple different types. I've got a Be Strong band, and I've got some rock cuffs that are out there. There's some really pretty good ones. And so what you do is you have to know your product too as well. But the long and short of it is that by restricting the superficial venous flow into the distal extremity, so you only use it two locations: the upper arm, around the inguinal area on the upper part of the hip, the upper part of the leg. So at a certain amount of pressure that a lot of times is just objective, what you'll do is you restrict that blood flow back in, and it creates this metabolic environment. You're fatigued. So your muscles, there's type 1 and type 2 fibers. So there's type 1 fibers are the ones you engage every day, like just sitting here, your postural muscles, those types of things. They have a lot of oxygen, right? So where you get big and strong is when you stimulate those type 2 fibers that are like the anaerobic fibers. The ones that are going to get you hypertrophy, that's like a 70 to 80% of your 1 rep max. When you're training heavy in the gym, you're trying to hit those you're trying to hypertrophy and get strong. And you're going to hit those type 2 fibers, those ones that are very not as oxygen dependent, but really responsible for muscle growth. Well, not everybody can hit those, and you can't do it all the time. So they found that by decreasing the amount of oxygen, and it pools down distally in the extremities, what it does is it creates, the body starts to recruit more of those type 2 muscle fibers. Those muscle fibers that are recruited first, fatigue out really quick. They get really tired really fast because they don't have good oxygen to them. So what it does is recruits the type 2s that are normally responsible for those heavy loads, right? So now you're recruiting more muscle fiber with less weight. And the thing they found is really cool about it for us guys and stuff like that is that you actually start to get a growth hormone release that you would normally get under heavy loads. So you get increasing growth hormone from the anterior pituitary. You get these insulin-derived growth factors that really help with muscle growth, muscle protein synthesis. And you also get a suppression of this myostatin. So you ever know those guys that come in, they crack me up, they're like, I worked out for 4 hours or 6 hours a day in the gym. One, I don't know how they get along doing that. I only got like an hour to get there, half the time before my wife tells me to get out of the garage. So, but what it does is that myostatin is a protein that actually suppresses muscle growth. So now what they found is the blood flow restriction actually blocks that myostatin, so you get better hypertrophy. So there's a lot of science behind it. And now with the advent of new products, it's a whole lot more safe. You have to have a little bit of knowledge, and there are some safety issues that you have to look out for first. But it's a super cool thing. So,
and what are the two areas again that you are safe to do that with?
What was your question again?
What are the 2 areas again that are safe to use that on? You said your bicep, and then where else? Yeah,
so you're going to use it. So it's not directly on the bicep. It's going to be upper the deltoid tuberosity up around this area, up in the upper arm. So when you do look into it, it's really a safe, when done correctly, it's really safe treatment, or it's just straight to put into a program. So upper arm, and then just above the inguinal fold and stuff like that, right around basically right in your groin, around the hip, the upper part of it.
Gotcha.
And so what we look for is a lot of observation. I call it the 4 Ps. You shouldn't have any pain with it when you apply it. You shouldn't have any paresthesias or numbness. Nothing should be numb. You don't want your fingers getting numb, your leg getting numb, nothing like that at all. You should have good pallor, so it means there's good color. You shouldn't have, something you strangle, something you got ischemia or that whitish color or like that at all. You might have a little dusky, but you want some good capillary refill. And then how's your performance? If you tighten that sucker right down, no matter what it is, what'll happen is you'll fatigue out really fast, but you won't be able to get any work done. So you want to make sure to have, and the found that is you don't need as much pressure as they used to thought in order to get the job done. So, reps and set schemes can vary. You can put it on for 20 to 30 to 35 minutes, somewhere in there. Sometimes you have to build yourself up a little bit. There's this rep scheme where you do like 30 repetition, 15, 15, 15. And usually it's lighter weight, only 20 to 30% of your 1 rep max. And you're doing, higher repetitions, higher volume. So what that is going to fatigue out those muscles. And it's really good for like deload phases. Maybe you come off a heavy program. I'm going to start mine in the next 2 weeks when I get off my 10-week program. And so there's some really good applications for it.
So really only biceps, maybe triceps, quads, and then maybe hamstrings, I guess. What are the muscle groups that you can use this with?
So again, what it is it's not a matter of muscle groups. It's a matter of what it does. It's got local and systemic effects. So basically they found that even if you band up or put it on one side, you actually get strength gains and growth on the opposite side. Why is that? Because of the brain, you're releasing these the hormones. You get it because the body's calling for this more aggressive recruitment of muscle fibers that you would normally get under heavy loads. So, I've actually done with some of my patients. I worked with a fellow who had a biceps tendon repair, and we actually gained significant strength and girth thickness on the opposite side when we were even training because of the BFR. So you basically, it's the application of the band or cuff itself.
Okay, so you could even see muscle gains because of the hormone benefits and say like your chest, back, stuff like that, even though you're just putting it around your arm?
Completely. Absolutely. Yeah.
I never knew that. I never heard that.
It's crazy.
Yeah, totally. You don't have to many times if someone has an injury on one side, I'll band the opposite side. Or I might not band that injury side. I might band the legs and I might band the other side that's uninvolved. But remember, that's what's the cool thing about this. And this is documented. There's a lot of research that's out there. You just got to go and you can type in muscle restriction training. You'll find a lot of the applications and stuff like that. Again, it's not one of those things that you just take out and nonchalantly strap something around your arm. But guys like us, there's some great companies out there that are really, really good as far as education and to show you the efficacy and safety of this. Yeah. So, for example, you can do total body workouts with it. I used, on my leg days, my knees ache. I've got a meniscal tear on my left side over here, and I strained my MCL on my right side one time. So sometimes they flare up. So I'll just do body weight. I'll throw the suckers on, maybe put 150 to 200 millimeters of mercury in the cuff or the band, excuse me. I'll pump those babies up, or I'll use a non-pneumatic strap. And then what you'll do is you'll get this fatigue factor. So that's what you'll start to feel. You'll start to feel that stuff kind of fatigue out below that. And so I do higher repetitions, and I'll just do body weight. And I'll tell you what, man, the pump you feel off those suckers, it's like you've just squatted, 400 pounds, for 10, 15 repetitions or something, and you've done only body weight.
How long would you say is a safe amount of time for a guy to stay banded?
Gotcha. So a lot of times you might start out light. Maybe you'll just sometimes I recommend guys do finishers. Maybe they're doing a chest and tricep or bicep workout or something. Maybe they do their heavy lifts first, and maybe the last 10, 15 minutes we're doing some finishers, some accessory work. I'm going to slap a band on, or a cuff, and I'm going to do maybe 10 minutes of maybe high repetitions, lightweight, that thing with 30 seconds rest in between each set, right?
Say a guy's working out for an hour and a half, though. Could he band up his, top of his arms and keep him on for the whole hour?
No, I wouldn't recommend doing it for more than an hour. Most I've done it for is about 45 minutes. So, and that's with me working up over a period of time. So you figure that you can get the benefits within 15 to 20 minutes of this heavy, high load work that you would normally get, that takes an hour and a half. You can get those benefits in a much smaller time without the muscle strain, joint damage, all the negative stuff that comes along with it. Now, will you be a little bit sore? Yeah, you may very well be a little sore a couple of days afterwards. But it shouldn't cause bruising, shouldn't cause pain. You should not be numb with this stuff here. It should be a good, comfortable. And the cuff or band does matter. You want to make sure you don't have a strap or a cuff that's larger than 4 inches. One of the things is you put it on the biceps, and if it's really long, you're not going to be able to get that muscle pump. Right? You're not going to be able to get that blood past that. You want something that expands a little bit if you can, so that pushes that deoxygenated blood back through there. If it's too thin, then what it's basically doing is you're just putting a rope around your arm. You have a higher incidence of nerve injuries, those types of things, or whatever. So
how wide?
I've trained with lots of different ones. So and I found a couple that I really, really like and do well with them, and they've been very comfortable. So.
How wide? What's a good width? What should guys be
about 2 inches? You want something about 2 inches, no more than that. And like I said, a lot of times it depends upon your body type too. I've seen, and I've been in, when I got trained, looked at a lot of different operating systems and tried them all. We know that with, let's say, a blood pressure cuff, you put that on your arm, right? You get that blood pressure, it shuts that arterial inflow down. So what happens is about 150 millimeters of mercury, boy, your hand starts to, they're getting that blood pressure to come back. And you're getting that, systolic and diastolic pressure. I used one called Be Strong. I've had one on there. It's kind of a bladder filled. It's a band. It's about 2 inches wide. It's an elastic type of cuff or type of band or whatever. And it's got some bladders on the inside of it. It's barrel bladders. And I've used it for the last 3-4 years. And I've never had it painful with it at all. I've never been bruised. Nothing. And again, you're supposed to be doing low loads with this. You're not supposed to be like, out, slapping 405 on a bench press. It's low load, work to help with recovery and muscle growth and hypertrophy, that type of thing there. So usually about 2 inches is a good width right there.
I got another question. So blood flow is obviously a big part of bodybuilding or building muscles in general. I mean, that's why a lot of guys will take blood flow supplements to get a better pump.
Sure, yeah.
The more blood that you get to your muscles, the more nutrients you get to your muscles, obviously the more your muscles are going to grow. Is there anything the guys can do besides supplements and this blood flow restriction just to have, I'm thinking, I guess in my mind, I'm thinking like if you have a stronger nervous system, you're going to have better blood flow throughout your body.
Yeah. So again, some of the benefits of this as well is that, again, it's like muscle pump. You're getting that muscle pumped into getting that blood pumped into those muscles. With this here, you actually see with BFR and stuff, you actually see an increase in like angiogenesis. There's actually some capillary regrowth, and they've actually seen in some studies better cardiovascular health as well, the increase in VO2 max. So what you do is, everyone, I always get people to say, you got to stop lifting weights, do some cardio. Well, I don't know about you, but I lift heavy things fast. Yeah. So that's my cardio right there, right? Yeah. And matter of fact, weightlifting, bodybuilding, powerlifting is just as good as the heart's muscle like anything else. So the way you train it is going to be is going to have a cardiovascular benefit as well. What I found with the BFR stuff as well, it's going to help with, again, capillary growth, increase in blood going to the muscles as well. And really, it really helps to perfuse that. And actually shown even in some studies that there's better EMG activity. With some of that, there's been some recent literature that comes out and looks a little bit at that. But again, with better oxygen to the muscles, better oxygen to the nerve, you get better firing and better control and all that good jazz. So
it's never a guy with a physique you want saying to stop lifting weights and do more cardio either. Cardio,
I hate cardio. I don't want to run a treadmill. I think it's awful.
So I am kind of curious because I heard you say a couple times if someone has an injury, you'll put it on their other arm, or sometimes you just do one arm. Would you recommend, since you do get the hormonal benefit, someone just puts one strap on? Or typically when you do it, are you doing both arms, both legs simultaneously?
Yeah, and so that's a great question. So yeah, a lot of times I might even just do one arm. Even if I'm training in the gym, if I want a more aggressive whole body workout type of thing, and that's a little more advanced, I'll put all four on, right? So maybe you're going to do things like, I don't know, you're going to do more calisthenic or box jumps, burpees. Who loves burpees? They're awful. So, that type of thing. Again, more of a to stimulate that there, or as opposed to maybe you want to do one side. You still get the benefit from that. And like I said, I've been using it for some of my patients right now in the clinic and stuff like that. And again, people that can't, let's say, for example, you just had a surgery, whether it be an ACL or whether it be, a shoulder surgery or something like that. And the doc says, hey, you can start moving, but maybe I want to get a little bit more muscle activation, some hormonal influence and stuff like that. I'm going to apply that. And if I can't do it on the injured side, I'll put it on the opposite side. And I'll start low load exercise, maybe simple active range of motion or, just very, very light, resistance, maybe 10 to 15% of your one rep max and work my way up a little bit. And then again, I'm going to get the benefits of that, both locally and systemically.
And you've seen noticeable changes in your own physique from starting to implement the blood flow restriction?
Yeah, listen, I'm a naysayer. I want to say, I'm going to show me guys, show me the evidence, that type of thing. So when I when I train in something, and I don't ever recommend something that I haven't tried myself. I don't know everything. You never will. I try to keep up on the latest stuff that's out there. So when I was hearing about this, I didn't use it for quite a while. I'm like, I don't want to restrict blood flow. It's just kind of crazy. So I was very thankful to be with it. Like I said, I traveled the country for a while, and I still do some teaching on these topics. I worked with a group that was hooked up with these guys out west in the Park City, Utah, with Jim Stray Gunderson and the Be Strong group and stuff like that, who also had other connections. And so when out there, I got trained on them. And so again, I was able to actually hear the physiology behind it, but actually do it. So I would get caught in those numbers games a lot. When I was powerlifting heavy and stuff like that. I always still like those numbers. I can't get them like I used to, at least not yet. So I went off some of the heavier stuff for a while and just did this for a little bit to see if I could maintain my strength. And actually, I went back. So I did a 10-week cycle of a powerlifting program or something like that. Took 4 weeks off and did just this for a little bit, maybe 2 or 3 times a week at very, very low loads. I remember I was in the gym one time and I had doing shoulder presses, and I had 15-pound dumbbells. So I'm doing shoulder presses, 15-pound dumbbells, and I'm completely fatiguing out. I got 30 repetitions out of it. I got my next set of 15. And by the time I got to this guy came over, he's like, what are those things? You can't even handle that weight. Like, dude, until you try these things, you're completely fatigued afterwards. And I found that when I went to my bigger lifts after to get back into it, I was just as strong, if not stronger. So again, I think we have to get out of this thought that we got to lift heavy. Yeah. Want to get stronger, that type of thing. But sometimes we need a break to recover as well. We need good sleep, good, exercise. We need some recovery periods. We need some mobility, stability training, that type of thing. And this is just another added type of intervention that may help us to achieve those goals. So yeah, I use it myself.
I got a question for you, and I want to change track a little bit. You're talking about your mobility day that you throw in every week.
Yeah.
What does that look like? Because it seems like, the busier I get and the bigger I get, the less mobile I get and the less time I have to stretch.
Yeah.
I love yoga. I love trying to do 15 minutes of yoga every single morning. And when I can actually stick to that, I stay a lot more mobile than when I don't. But it's just hard to get that into your routine every single morning, things happen. I mean, the other morning my dog took a big fat shit in my room, then oh man, I got to clean up dog shit real quick. I didn't have time to do my yoga stretch,
Right.
Life happens. So what is I guess the thought of having an actual mobility day to me that I can actually still go to the gym and have a mobility day is intriguing. That's something that I could fit into my actual gym time opposed to trying to do these stretches every day in different time,
Totally. Yeah, absolutely, man. I got to tell you, if I'm honest with myself, it's only been probably the last year or so that I've been throwing this in there. And it's mostly because we've been plagued with injuries over the years. Here I am rehabbing people. I'm trying to do this myself. And so I said, I really got I had a real sickness over this last summer. It wasn't the Rona or anything like that. I don't know what the hell it was. But anyways, I got real sick and I really got weak. I lost a shitload of weight and stuff like that. I just got really sick. So I think it was that point where I just started to kind of take a little different perspective on building myself back up. And I just needed to address some mobility issues. Like I said, my issue is hip mobility, lat mobility, shoulder mobility. A lot of that stuff is not that I'm not strong. It's just that things are tight. So I started looking at things and say, geez, I want to kind of get in and make a separate time, because I'll tell you, when I get up, if you get up at 4 a.m. to work out, half the time I'm not going to spend 30 minutes probably warming up. I'm just going to hop right into the workout half the time. I probably shouldn't, but I'll do a little bit there. But to have a dedicated time, on a Saturday morning or something like that, I can set aside. So what I might do is I might just get my core temperature up, stepper, whatever I want to do. I got a stepper out in the gym, maybe a wind bike or something really quick, 5 minutes. I'm not going to spend a lot of time on it. I might do things just like you did, world's greatest stretch, a little bit of 10, 15 minutes of yoga. I know that my posterior shoulder is a big issue for me, so I'll spend some time doing some mobilizations and, those types of things, even some light weightlifting moves just to help with fluid movement and stuff like that. Make it kind of fun. I'm not out to look to push any weight. I'm just out to look at some of those areas. One of my things too is I've got some weakness of my hamstring and stuff like that. They're not as strong as my quads. I'm always trying to work those. So I might sit and take a look at more maybe banded exercise at that point. And just kind of fit those into an overall whole body routine. And I honestly tell you the truth, I kind of felt better. So I take about an hour to do that. And then at that point, if it's something I want to maybe work on a little bit, maybe I want to do a little BFR, maybe I want to do something else, I'll just throw it in. I'll make it more of a fun day. Maybe that's where I'll get out I got this monstrous like 6-foot tire out there and a couple of sledgehammers. I'll flip that around a little bit, throw it out for some cardio work and stuff, and pull some sleds. But I'll make that more of my fun, Saturday. We're not having to rush around and do stuff day. So I think that's been helpful. It made me want to do it because sometimes my workouts are like, oh gosh, I got an hour. I got to get whatever I got to do to get into that workout and get done before I get ready for work. So
right,
it's hard.
I got a question that's a little less technical for you, but I feel like a lot of our listeners can relate. So obviously when you said you've been lifting since you were 14 or 15, it's ingrained in you, but a lot of dads, when we're taken out of the bachelor life and no real responsibilities and all the time in the world, and we get thrown into being the provider, the husband, the father, you're working, traveling, like you said, you did probably more so before this last year, but how have you maintained your, I've said it twice now on this podcast, but your eye of the tiger, your motivation to keep getting after it?
Yeah, mostly it's because I feel shitty about myself after a while because I'm getting fat and soft. So if I'm honest, but like I said, I did my first teenage bodybuilding competition at 15, and I came in 4th place out of 4 people. So that was my claim to fame. So I came in freaking dead last and had the bug ever since then. So, and then it just was part of who I was after a while. I was always a scrawny little kid. I'm about 230 right now. And I was like, at the time, maybe like 155 pounds or something. And I just kind of grew over time and I loved it. Caught that bug. You get those little sand weights in the mirrors and you see a little bicep going. I'm like, oh, this is awesome. So, over the years, I've had my ups and downs. And I remember training 6-7 days a week when I was powerlifting and stuff like that for a while. And then, before I had any responsibilities. And I just talked to a guy the other day in the gym. He's like, I'm training like 6 days a week. I'm thinking to myself, oh my gosh, if I can get 3 good 4 solid workouts in there, I'm happy. You go through those times. I got 2 awesome girls. They drive me nuts, but I love them to death. And, they're stronger than most of the boys I know. So I try to incorporate my kids into it as well. And so that helps out a lot. There was a time where, man, I wasn't consistent as that. So I kind of got down a little bit. I'm like, oh my gosh, some days I get 2 workouts in a week. Some days I get 1, based on, you got to take care of family first. Right. And now that the girls have gotten a little bit older, I've been able to integrate them more into it myself. So, my daughter and I were working out. My 20-year-old last week, she's getting ready to get into PT school, and my youngest daughter, my 15-year-old, she's running track. We do some cross training and stuff like that together or whatever. And she's like, Dad, it's so annoying. But, she'll do it with me every once in a while. And I think for one thing is you just keep that keep at it mode and not give up. You're going to have those ups and downs. Don't get down on yourself. I'm not a partner guy. I'm just a bull. I want to get it done. So I have time where I'm in there. I'm in my hour and 15 at the most. And so you can, if you're a partner guy, find someone to push you through it or something like that. I tell you the truth, man, guys, I love this whole COVID stuff in the last year. So finally, my wife let me spend some money and I built my garage gym. Stuff I've collected since I was 15 years old. I went to Home or Tractor Supply, bought a bunch of 3/4-inch flooring and dropped some lights in there, put new drywall and all kinds of stuff. I love it out there. I'm so much more consistent. If there's any bit of advice over the 35 years I've been training, I've read articles and talked to people and all kinds of stuff. Some great folks. It's consistency. I don't care what it is. I've taken more shit probably over the years, spent more money on supplements and all kinds of stuff that really haven't done a whole lot. Nothing beats a solid workout program and consistency. I don't care what you do.
So you just love the way you feel when you do it, and you don't like the way you feel when you miss.
Seriously, yeah. I don't know about you. You guys. If you guys train all the time, you get people talk about that runner tie. I'm telling you what, man. I can go in there in a crappy mood, and I walk in the door. My wife's like, "Just go out in the garage." I'm like, come home. I'm like, oh my gosh. She's like, I can see it in your face right now. When I can't stand you, so just go someplace. So she kicks me out of the house. I'll go out in the garage. I'll pound it out there, and I get out of there and it's like, I feel like you get just like exercise, you get that endorphin release, you get that calming effect. Dude, I've had some of the best workouts on a little bit of extra anger, so I've been able to direct that stuff there. So I think honestly it's when you got to love it. and it doesn't, not everyone has to have the same program. And I think the other thing too is have a goal in mind. Make sure you have some kind of goal to shoot for something. Because if you're just out there, going by the seat of your pants, I keep a little notebook there, look at my numbers, here and there. I want to do this, X, Y, and Z. It gets boring after a while. And what you want to do is make sure to keep that flame going. I like to change things up, switch things up every once in a while. And that helps me motivate it.
Yeah, I think especially guys that travel, office, desk jobs that just get absolutely no physical activity. You hear guys that do jujitsu and that's like their favorite thing in the world. CrossFit, same thing. You need some sort of physical activity. I won't even say as a man, as a person, just to get that endorphin release and let some of that stress out. I think it's so massive.
Well, I got to tell you too, even with these like the BFR bands, cuffs, whatever, like if I was going to teach an instrument assisted course or teach on BFR or something like that or whatever, or travel, but hotel gyms suck. Awful.
Right.
So you're in there. So I take these bands in with me and I do like either a bodyweight workout or throw some of my own bands, like resistance bands in with my BFR cuffs and stuff in my bag. And I'd pound out a workout in there. I feel like it was just, drag through the ringer. And so again, 15, 20 minutes, that type of thing, total body workout, you get a great pump. You get the effect of that heavy load and stuff. So I've used them personally for years. And so it's been a nice addition as well. And you still get that, again, you get that endorphin release, that sense of well-being. Probably the biggest thing that's made me feel good is that when my daughters come by and say, hey, so-and-so saw you the other day, and they think you're big. I'm like, yeah.
How often, so say a guy like me that's in the gym, I lift 6 days a week. 1 day a week is just cardio. I do cardio every day, though, but one day I don't lift.
Right.
If I wanted to try this BFR training, throw it into my routine, how many days a week would I do it?
So there's different phases. You can do it like in a restorative phase or a maintenance phase or a rehab phase or something like that. But you can do it, again, because you're doing it on low loads. That's low load, 20 to 30% of your 1 rep max in there. You're doing higher repetitions. You can do it between 4 or 5 days a week. Sometimes you can do it within the same 24-hour period. Sometimes people have split it and done it in the morning and then in the evening. Got some cases that we use. We teach BFR on the rehab end of things. Some of our guys have done it twice a day, especially some of those top end like skiers out in Utah and stuff like that. When the pros and Olympic guys are using it and stuff like that, then there's something to it, right? So during those, and again, it's going to be short bursts of period of time. Like for example, I've just got done with my 10-week. Well, I've got another week here coming up. I'll be in my 10th week of my powerlifting program that my friend Muscle Mary put together for me. And then I'm going to do about 4 weeks of some BFR. So I'm going to do a lot lower load. I'm going to detrain a little bit, deload a little bit, take some pressure off the joints, but still get that same benefit. So I'll probably do it 3 days a week at least. So
I'm thinking, I try to hit every muscle group twice a week. So I'm thinking maybe one of the groups or one of the times a week per muscle group. I could go heavy load, not do the bands.
Yeah.
Just stick to my normal routine and just push it really heavy, as heavy as I can.
Yep.
And then the other one, I could go a little bit lighter load, higher rep, and use inclusion.
One of the things if you haven't experienced it, man, you got to try it first. So again, get a good product. You don't have to spend thousands and thousands of dollars. There are some that are like $4,000 or $5,000. Some of these larger ones that are hooked up to a blood pressure machine, and this is more of it's an automatic thing. And there are ones that are anywhere from $200 to $300 or $100 or less. But again, you should look at the company, know your product, and know the education behind it as well. You should know a little bit about it. So there are some contraindications to it, like you have deep vein thrombosis, or like if you have like lymphedema, or are pregnant. Hopefully, no one out there, none of the dudes are pregnant, but that type of thing. Some other things you really should be aware of, right? So and just be careful. If you have any kind of peripheral vascular disease, those types of things. Hopefully we're trying to feel healthier. So if you smoke a ton of cigarettes, it's probably not a great thing. I like to have a cigar and a whiskey every once in a while. I'm not out there, toking a pack or two down a day. So anything like that at all, even hypertension. I've got, like a controlled hypertension, some blood pressure issues on medication. I've been using that. I never had, blood pressure issues until I got married, but now I have blood pressure issues. So, and I've been using it with that. It's controlled. So, and actually been shown to have some reaction reduction in blood pressure with that as well. So there's some simple things you should know. And again, adding it to your program until you've tried it. I'm telling you what, I've been to some courses and I'll put a band on one guy's arm and then I'll have him do a 20-pound dumbbell and then a 20-pound dumbbell on the unbanded side. I just did it with my student last week and I threw it on Instagram. And by the time he got done with his 30 repetitions, 15 repetitions, 15, 15, 15, that's just a general algorithm that's been used in the research. He was totally fatigued out on the banded side and felt like he wasn't doing anything on the ball side. So, and the pump in his arm was significant. So it's really a pretty thing to feel. And you'll know once you get into using it that you're not going to be, again, you can do a heavy part of your workout to begin with, maybe do your bench or squat or whatever you want to do, and use it as a finisher. Get in the last, exercise or two, and then it's completely roast yourself at the last, 10 minutes of your workout.
I love it. All right.
Yeah, that's cool.
Dr. Jim Wagner, thank you so much for coming on. There has been a ton of actually, awesome knowledge in this podcast. So I love it, man. A lot of stuff I didn't know about. I mean, there's a lot more science behind that than I thought there was than just throwing a strap on your arm and lifting some weights. Yeah,
there's really a lot more out there. And as I said, I encourage you to always make sure to look at the safety first, but there's some really, really good research behind it, that stacks of it. And I've got some really good friends that teach it and know the science behind it. And when you apply it, it can be just as great benefit in the home gym as it can in the clinic and stuff like that. And I encourage you to look into it, try it, be safe with it, and incorporate it in your workouts and give it a shot.
Yeah, I'm thinking out loud too with COVID still going on in a lot of places and gyms still being shut down in some places. This might be a good alternative to guys doing workouts at home as well.
Oh, great. Yeah, because I've got my set. I throw it on the gym and do it at home. And it's a great, even with limited equipment. All you need is some body weight stuff, maybe some bands or something like that. And you can go right to town. So
awesome. You got anything else you want to add, Joel?
No. How can people support you, Jim, and learn more about you?
I'm not a big social media guy. I do have one. Yeah, I've got a strength_therapist 71 online, if you want to go on Instagram a little bit like that, or, I do some work for Hawk Grips Instrument Assisted Soft Tissue Mobility. So I travel, do some teaching there and teach how to use blood flow restriction with B-Strong. And then we'll get into some other things like rock puffs and stuff like that as well. There's a lot of good stuff that's out there. You can always shoot me a message online if you want to know more about it. I might be able to get some people or something like that there, or even give you some tips and strategies. So
awesome. Well, thanks again for coming on the show. A lot of good, useful knowledge in this podcast. So I appreciate your time. You took out of your morning here to come on and teach us a little bit.
Hey, thanks for having me. I appreciate you guys very much.
Absolutely. So this has been the Dads Who Lift podcast. Thanks for tuning in. Please give us a like, share, 5-star review. We do this stuff for free. We don't have any ads or anything like that. How we want to grow this thing is organically. That happens by you telling a friend. All you got to do is tell one person, they tell a person, they tell a person. And that's how we get our message out there. And all we want to do is add value. So if you feel like we added value to you here today, please tell a friend, give us a like, share, 5-star review. We really appreciate your support. We are on IG as Dads Who Lift Official. We have a website with all the podcast formats on it, YouTube, Spotify, SoundCloud, all that stuff. We also have apparel for Dads Who Lift as well on the website. The website is www.dadswholiftofficial.com. IG is Dads Who Lift Official, Facebook Dads Who Lift Podcast. We also have a Facebook group on Facebook that's full of 48,000 now, something like that. It's growing like crazy.
Crack that 50.
Yeah, 48,000 dads that are just like-minded dads trying to be their best selves and stay fit at the same time. A really fun group too. It gives each other a lot of shit. So if that's something that interests you, check that out. That's again a Facebook group called Dads Who Lift Official. But yeah, thanks for tuning in, guys. Have a great day.
It's forever, this like forever, no surrender. It's forever, this like forever. I bigger dead than alive, bigger dead than alive. I bigger dead than alive, dead than alive. Yeah, I bigger dead than alive, bigger dead than alive.